أهلا بكم في تلفزيون CardioAlex. And with us, Dr. Antonio Colombo, Professor Cardiology in San Raffaele Hospital in Milano, Italy. Hi, how are you, Doctor?
Thank you for having me here.
We are always welcome here. What do you think about CardioAlex 2017, and is it meeting your expectations?
I think there is a large attendance, and this is a very, very important. The location, as usual, is excellent, so I am very happy and positive about how this meeting is going.
Okay, what are you going to present this year?
This year I presented in the morning a lecture about the future of interventional cardiology. I discussed about a new approach to treat coronary artery disease, where we are going and where we expect to improve, and also I introduced the field of structural heart disease, which is treatment of aortic valve with aortic valve transcatheter implantation of a new valve, treatment of mitral disease with mitral repair and possibly mitral valve replacement, treatment of PFO, patent foramen ovale, and tricuspid regurgitation. So all this new field, which is a newborn for Egypt, it will continue to grow. Transcatheter aortic valve implantation in Egypt is new. Only about 300 procedures have been performed, but I expect next year we will see doubling and tripling with the year to come. In the afternoon, I will discuss about transcatheter valve implantation in more detail. We will have a specific session with a transmission from Germany, where they will present new valves and new procedures in this field.
Okay, what is your opinion regarding the new bioabsorbable stents?
As you know, this is a very controversial field which has undergone a lot of changes, some bad press recently with late events of stent thrombosis. Most of the time we believe that this inferior outcome compared to meta stents is due to incorrect implantation technique. We have proposed a new way to implant these devices with IVUS intravascular ultrasound guidance with high pressure pulse dilatation, and the results are better. We also look forward for new bioresorbable scaffolds with thinner struts. The one that we use now are 150 micron. The new one will be 100 micron, so significantly smaller, and they will perform better, more accurate and complete coverage by endothelium, maybe less thrombosis. So I think on the long term we are positive, but we are still to overcome some of the problems. So the field is not growing fast, has to go through few problems to be resolved.
Okay, when to evaluate intermediate lesions using IVUS or FFR?
IVUS is appropriate, but in my opinion FFR or IFR are more suitable to evaluate intermediate lesions. IVUS gives you a cross-sectional area of the lesion. FFR or IFR gives you not only the impact, the cross-sectional area, but also the impact of the cross-sectional area upon the myocardial bed distal to the lesion. So if the area is small and if the lesion is small but the area is small, the fact that it's small is no consequence. If the lesion is small but the area is large, the consequences are more relevant. So I believe FFR should be the first line to evaluate intermediate lesions.
Okay, what would you like to see in CardioAlex 2018?
But I hope that in 2018 we will have more room for structural intervention. As I said, they are at the infancy in Egypt now. I believe that next year we will have more operators performing this procedure. So next year we will have more sessions regarding these topics.
Okay. At the end, we would like you to say a word to the people all around the world to come to visit Egypt and that Egypt is safe. How did you find Egypt?
Egypt is safe. Unfortunately, no place in the world is 100% safe. We are in a very difficult time, but here in Alexandria I'm facing the Mediterranean Sea, very beautiful weather, not hot, dry, and I think people should feel comfortable to come to Egypt and visit this wonderful country.
Okay, thanks a lot, doctor.
Thank you.
Thank you.
Thank you.
We hope that you enjoy and see you next year. Bye-bye.